friend Brittany Adamiak. She's a pediatric dentist. I had so many great Instagram questions, so I wanted to actually go to a pediatric dentist to make sure we were getting all our facts right. So she volunteered. She's the owner of Green Hills Pediatric Dentistry. I'm going to let her introduce herself.
Hi guys, like Dr. Clegg said, I go by Dr. Brittany, and when she reached out to me I was really excited because a lot of the questions that you guys asked are questions that I get every single day. So I think it'll be really fun for you to hear answers from both of us.
Okay. As a mom and a dentist, I get a ton of questions, and actually this one the answer was a little bit surprising to me. I have a 19-month-old son, and the biggest question that I'm getting across the board from my friends that have similar age kids is, should I be using fluoride in my toothpaste? When should I start using fluoride in my toothpaste? And when should I not? Because a lot of people are really worried about too much fluoride. So can you give me a couple answers for that, Brittany?
Yeah, absolutely. This is a question I get all day, every day, and parents, naturally so, want to be careful about what they are putting in their child's body, toothpaste included. The rule of thumb, and I practice by the guidelines that the American Academy of Pediatric Dentistry releases, and that is universal for all pediatric dentists, and it's evidence-based. And what that says is, as soon as the first tooth erupts, it is safe to start using fluoride. The key is that you have to make sure you're controlling the amount the child's getting. So for children 2 and under, it's safe to use, they say a smear. I like to say the size of a grain of rice. And that's 0.1 milligrams of fluoride. So the next follow-up question when parents say, and I'm sure you probably think the same thing, but they can't spit. That's what they always say. Well, we aren't using it because they can't spit. So even if they can't spit, when you're controlling the amount that's on there, it's a safe amount. We know they're going to ingest all of it. Then kids 5 and under can get a pea-size amount, and that's 0.25 milligrams of fluoride. And that is a safe amount that's going to help prevent cavities, but you're not going to get any adverse effects.
That's awesome. Thank you. Okay, so the next question that I got that kind of goes along with this is, when should we start brushing my children's teeth, and how many times a day should I be brushing my child's teeth?
Okay, these are all really good questions. As soon as the first tooth erupts, you want to start wiping it off. And you don't have to be using a toothbrush necessarily. You just want to make sure that you're removing any plaque from the tooth. So there's toothbrushes that look like a thimble. They fit over your finger, and those are easy to kind of get in and massage the tooth and gums. You can also use a wet wash rag. So just a washcloth, you can put it over your finger and just gently massage the tooth and gums. So as soon as they have teeth, you want to start brushing them. In terms of how many times a day, I think it's most important that you're doing a really good job nightly. So it's ideal once a child has a mouthful of teeth to be brushing twice a day. But initially, if you're doing it at bedtime, then that's sufficient enough. And then it's also important, if you're still nursing or they're still feeding during the night, that you wipe the teeth off after any of those feedings as well.
That's smart, because that's really hard to do. I know moms that are out there, you know how difficult that can be, especially when you're exhausted and it's the middle of the night. It's the third time your kid's woken you up in the middle of the night. So there is a little bit of wiggle room. I haven't always been 100% on that, and I'm a dentist myself. I know how tough it is, and that's why I'm here asking Brittany a lot of these questions, because I actually have the same exact problems. Okay, Brittany, so I know as a mom and a dentist that I went to go on Amazon to buy toothpaste and a toothbrush, and I literally had no idea even what to choose. It's not as simple as an adult toothpaste, especially because I didn't even know you could use fluoride in kids under 2. I know that it says oftentimes on the toothpaste label not to do it, and obviously you've explained to us that that's actually okay as long as you are making sure that they do not eat more than the specified amounts of fluoride. It's really important. But do you have any recommendations as far as types of toothbrushes and also brands of toothpaste that we should be using, both fluoride and maybe even non-fluoride, for people that are really concerned about fluoride?
Yeah. Toothpaste, my favorite brands are Tom's, Hello, and Burt's Bees. Those are all, they have good quality ingredients. They don't use artificial dyes and things that we're trying to really avoid. They also have really kid-friendly flavors, and that's one of the most important things, because if they don't like the taste, they're not going to want to brush, which is
That's a
already
good point.
hard enough. I think the most popular toothpaste is Tom's Silly Strawberry, and it comes in fluoridated form and fluoride free. So you have both options, and it's good if you start them without fluoride and they like it, you can just switch them over and you know that they're going to be able to handle that flavor.
I thought that was such a good point because she had sent me a response earlier to some of the questions that I'd asked, and I read that and I thought that was such a good idea. That way you're not like adjusting your kid too much. So for those moms who are really super concerned about fluoride, you know, just start with the same. If your kid likes that one, then they'll never know the difference when you upgrade. So I thought that was a really good point.
You kind of just sneak it in there.
Yeah.
And you never know the difference. For toothbrushes, the most important thing is that you want a soft bristle toothbrush. You don't need anything firmer than that. And it needs to be an age-appropriate size. So they will tell you when you're searching or if you're at the store and you're looking at the packaging, because the toothbrush head needs to be appropriate for the size of the child's mouth. Otherwise, any of your major brands, your Crest, Colgate, all of those toothbrushes are going to be great quality. And then, you know, a lot of parents are asking if they should be using an electric toothbrush. So electric toothbrushes are great because kids tend to like them. And they also start to desensitize their mouth to the vibration that they'll have when they come for a professional cleaning. So it kind of helps prepare them for coming to the dental office as well.
So how soon can you start using one of those toothbrushes, like an electric toothbrush? Like how early do they make them?
So you can use them as early as 2. And one of my best friends has a 2-year-old, and he uses the children's Sonicare. I babysat him one night, and we were brushing, and I didn't even know. He took out Sonicare, and I was like,
That is awesome.
wow.
Okay, so now that we were just talking about the Sonicare toothbrush and starting them as early as 2 so that they're getting ready for their first dental visit, when should their first dental visit be, and what does it consist of at the age of 2?
Okay, yeah, that's a good question. So the American Academy of Pediatric Dentistry has their catchy little phrase, the rule of 1. And so what that means is they recommend that a child's first dental visit be by 1 year of age or within a year of the eruption of the first tooth. So that's a really huge range because there are kids that are 15 months old and don't have their first tooth. So if they come within a year of that, they could be closer to 2.5 or 3. So I kind of like to use the rule of thumb, by the time they're 2, they should have, if not a full mouth of teeth, at least some. So that's a good time to start getting them established.
Okay, yeah, my son, just for the record, everyone always compares like teeth and how many teeth people have. My kid is 19 months old. He's just getting his first baby molars. So, you know, some of his friends have like all of their teeth already and he's just barely there. And I guess I dropped the ball on the first visit, but
No,
he was a little bit late. I think he was maybe like 9 or 10 months when he got his first tooth. So,
you're still definitely within the range. And there's such a wide variation when the teeth come in. And that's the other thing. Did you see, I don't know if you noticed, Chrissy Teigen brought her child in for her first visit when she was 3. And she posted it on social media, and it was a big deal. And people went crazy on her about how she should have been bringing her since she was much younger, and were just like attacking her. And it kind of brought that debate about, and every child's different. So
yeah, I mean, I've seen some at my office where like the first visit, it's when they're 5 and we can't get any x-rays because their mouths are too small. And that's like a really good reason to consider a pediatric dentist, is because a lot of times the cavities between the teeth we can't see clinically. And so when a kid comes into my practice and I can't get these x-rays, I can tell the parent, well, this looks good from the surface, but I honestly just don't know what's going on underneath. And if it gets past like probably the age of 3 and the kids still can't take x-rays, I generally refer them to the pediatric office if just to get the x-rays. So I still treat kids just like she treats kids, but they're just more specialized in treating kids. So in some ways, you know, I love seeing kids in my practice, but in some ways, like these offices are just much more tailored to seeing kids. And that's why I'm at this office asking these questions for you guys today, because I know it's really like in the first couple years of life, you have so many things to worry about and like so much pressure from everybody to do the right thing, and like I haven't always done exactly the right thing, and so it's better just to know. And if you haven't done it, just do it. It's no big deal. So we're not judging you. Brittany's not going to judge you. I'm not going to judge you, but just make sure you make that first appointment. And then with that being said, when a 1 or 2 year old comes into the dental office, what are they doing?
And that's a really good point, because I think a lot of parents don't make that appointment because they don't think their child's going to do well, and then their next thought is, well, they're not going to be able to do anything. So what's the point? And I'm sure you do the same thing in your practice for patients of every age. You cater the appointment to the individual child. And so you start slow by introducing them to our little stuffed animals with teeth. Let them brush, let them use a mirror, and familiarize them with some of the dental tools that we would use on them. We start with what's called a toothbrush prophy, where a toothbrush is familiar to them, and we'll start by just brushing with a toothbrush. And a lot of times while you're in there brushing, you can do an exam and see if anything's going on, because you're already in the mouth. Some children surprise their parents, me, everybody, and they'll hop up in the chair and let us do everything. But more often than not, that's not the standard.
You pretty much just want to bring your kid in to let them know that the dentist is not a scary place.
Yes.
The bottom line is that even if we can't do anything for your kid, your insurance is probably covering this appointment anyways, and you have the benefits, and you should just bring your kid in, let them get familiar. A lot of people have a lot of scary thoughts around the dentist, and they just are afraid. And if your child's first visit is when they have 5 or 6 cavities and we have to do all this stuff, they're going to have a completely different perspective of the dental office. Whereas if you bring them in earlier, they ride the chair, everybody's nice, there's stuffed animals, all this kind of stuff, you're going to change sort of the way that your kid's mindset is. Okay, so actually one of the questions that I had for Brittany is my child, I have a 19-month-old boy, I also have a 7 or 8-month girl, but she's not really quite as rambunctious as my son. But he would not, when he was maybe 6 months to a year, he would let me brush his teeth, but now he sort of has more of a say-so in what's going on, and his mood dictates more how he's going to do it, and I don't want to force it on him, but clearly it needs to get done. So I asked her this question, and it actually changed my life. So I'm going to have you answer, how do you brush a kid's teeth that doesn't want to brush their teeth?
Right now, the best advice I can give you is distraction. And sometimes it can be an older sibling that can help and, dangle a stuffed animal. But basically, if you have an iPhone or an iPad, it's a special treat. Usually parents are restricting technology, and let them watch something, a song, a little portion of their favorite show, and distract them. And that's typically the easiest way. That's why we have TVs in the ceiling here, because
kids are glued to this. And so I used to try to do this in the bathtub, and it was maybe a 50% success rate. So that was another one of her tips, is have it part of bath time, do this bath time, whatever. Well, that works half the time if you're a parent, you'll know this. But as soon as he got to watch these YouTube videos of animals and things like that, because he's really into animals right now, he will let me brush his teeth for 5 straight minutes if that's what I want to do. So that has been a huge help, and I just really appreciate that. And I know a lot of you moms are probably just how am I going to do this? That's how.
Perfect.
Okay, another personal question from me is, my child loves pacifiers. He's a huge Wubbanub fan. And right now, because his sister utilizes a pacifier, my kids are 11 and a half months apart, it's not super practical to break the habit, because if I move, she's not obsessed, but he is. And so if I have pacifiers in the house, he's going to find it, he's going to pick it up. And so it's going to be much more hard or difficult to enforce. Whereas I think a year from now, maybe that's going to be a simpler thing. So he's 19 months old. I can already tell that he has his 2 front teeth are kind of a little bit book
Mm-hmm.
at this point in time, like exactly where the pacifier goes. Like, is this something that is permanent? Like, is this going to affect his adult teeth? When is it good to break the habit of the pacifier? And I know some moms are definitely struggling with thumb sucking, finger sucking. What's the worst situation, and how do we fix that?
So, you're not alone. I guess to start with the last question you asked, what's the worst situation? Probably if they have a thumb or finger habit, because you can't remove it. So if I had to choose, if I had to give my child one, I'd probably prefer them to have a pacifier, because eventually you can take it away.
Right. Do
The-
you find that kids that have pacifier issues end up sucking fingers or thumbs, or is it a completely separate thing? That's what I thought.
They usually have one or the other.
Got it. Okay.
Your goal in an ideal world would be to break the habit by the time they're 3 years old. And part of that reason is you will, like you said, you'll start to see the effects of their teeth. They'll start to stick out some. You'll start to see when they bite down, there's an opening where the teeth don't overlap. If you stop by the time they're 3, usually all of that is reversible. And so things will kind of just settle
Like
back
without intervention?
Mm-hmm.
Okay.
Yeah. The bite will close, the teeth will get pushed back just from the musculature in your lips and cheeks and everything. And most kids kind of gradually wean down from having it all the time to having it when they're sleepy and upset. And then it's usually just bedtime is the last portion to break. So right now, if yours are 19 months old and
7.
I mean, they still need it. And when they're that little, they need it to cope and to soothe themselves.
Yeah, because I noticed little sister, his Cleggy's little sister, she's more, like, I initially started noticing she would put fingers and things in her mouth, and I was like, no, this is not good.
Yeah.
So she doesn't need the pacifier as much as my son does. He's literally addicted, but I noticed that she started doing that. As soon as she started doing that, I just introduced the pacifier instead and somehow was able to break it. I don't know that a lot of parents get success with that, but I just knew that probably was going to be a harder thing for me to deal with in the future.
That's great.
So as soon as I saw her doing it or putting her thumb in her mouth or whatever, I would just put the pacifier in because I figured it's one or the other.
Yeah.
So I'd rather just do the one.
That's a really good suggestion.
Okay.
I hadn't even thought about that.
Yeah. Well, that's the stuff you learn.
You learned it as a parent. Yeah.
So getting back on fluoride, another question that I got on Instagram was from a girlfriend of mine, and she said that her friend's pediatrician had prescribed their 1-year-old fluoride drops. And she was wondering, like, okay, do I need to have fluoride drops? Like, what's this all about? Why would they prescribe this? And, like, I thought fluoride was bad. So how do you respond to that?
So I've been practicing 11 years, and I have prescribed fluoride drops once. In general, your best sources of fluoride is the water, and it's government controlled and it's free. Some cities and counties are removing the fluoride from the water where they never had it, or if you're on well water, then you don't have fluoride in it. And it used to be where if you didn't have fluoride in your water, if you were on well water, you would get a fluoride prescription. What they found, though, was that you were getting a sufficient amount of fluoride from other sources, from your toothpaste, from your
Diet, right?
From your diet, even canned foods. Grape juice, apple juice are high in fluoride. So they found that it wasn't necessary, and people were oftentimes taking too much when you were prescribing it at home, and that's when you were getting issues of, people having too much fluoride.
You were telling me about, like, if you are somebody who's in an area with not fluoridated water, you were telling me about nursery water.
Yes. So you can purchase bottled water. It comes in a 2-gallon jug. It's called nursery water, and you can find it anywhere they sell bottled water. I mean, Target, Walmart, Kroger.
And I never even knew about this.
And it has fluoride in it. So there's also other people that just buy bottled water, and that's their preference. That's what they have at their household. And so I tell the parent, if you prefer bottled water, then make sure you're getting nursery water when they're younger so that it gets incorporated into the developing teeth.
Okay, so this was one of the best questions I got on Instagram because my son and my daughter both get tons of ear infections. If you guys saw my post this week, I had a really tough moment because my daughter had a double ear infection, 100-degree fever, and all this stuff. And, this is just something that moms deal with constantly. So one of the questions was, if your child gets frequent ear infections or kids that are sick, they get antibiotics all the time, and they said that they had heard that there was some links between amoxicillin, which is probably the most commonly used antibiotic, as long as you're not allergic to penicillin, and tooth development. And so this was something that I actually had not heard of and is a really smart question. And so what do you know about that, and what is too much amoxicillin, and what are you seeing in your patients?
Yeah. It is such a great question, and it's hard. So let me backtrack. What we do know for a fact is that there has been an overabundance of antibiotic prescriptions recently. That's why we get the guidelines change in terms of how we're supposed to prescribe it.
Yeah.
And in general, people were getting way too much of it. And what we saw was when children were getting specifically amoxicillin, but it is linked to other antibiotics, during certain stages of tooth development, they have what's called enamel hypoplasia, and they have weak enamel on these permanent teeth. So much so that they even have coined a new phrase for it. It's called molar incisal hypoplasia, and it affects the molars and the front teeth. The problem is you can't do testing on kids, so we're just kind of retroactively seeing what the teeth look like and how often they were on antibiotics. So there's no certain number. It's not like if you have 2 prescriptions within a year, they're fine. If they have 5, the moral of the story is, I think, making sure that you find a pediatrician that's in line with your opinions. And I know it's hard when your child is sick and you want to help them. You don't want them to suffer, but not every single ailment needs an antibiotic.
Sure.
And
you'll notice that your pediatrician is pretty hesitant to prescribe antibiotics for the most part, and they do have a guideline, as far as what is too frequent of an ear infection, and they will, without getting tubes. And one of the things that Brittany said is maybe have this conversation with your doctor. If your kid is getting tons and tons of ear infections and is always on antibiotics, maybe it's time to talk about should we get tubes in the ears instead of doing antibiotic therapy and all these different things. So just being aware, I think, is the most important thing. Obviously there's things that are out of your control, but if you're aware and and you're having that talk with your doctor and things like that, then at least you can make informed decisions. You guys can make decisions together. I know personally I had tubes in my ears when I was a kid, and I don't seem to have any repercussions from it. I just got a ton of ear infections, and so it was just something that I needed to have done. And it's also something that kids generally grow out of.
Right.
So I guess, anatomically, a lot of things drain into the ears when they're younger, and then as we age, things change, and so we don't get them as frequently. So if we can get them out of these critical periods, either through antibiotic use infrequently or tubes in the ears, then hopefully we can keep them from having these, effects later in life. Now, they're not completely horrific, otherwise this would be spoke about more, but a lot of parents will come to me when kids are older and be like, well, how come my kid's teeth look like this, And so this is just a good knowledge point, because this will be a permanent effect on the way that the teeth look, and the treatment options really aren't great for that. And that's another thing. Maybe in the future we'll do a braces segment or something like that. But any type of enamel changes or anything like that is really not easily fixed. And so those are the things that I'm always stressing to parents, hygiene and things like that, because once cavities start in certain areas of the teeth, some of them are easily fixed and some of them are not easily fixed.
Yeah.
So I just want to thank you guys for all of your questions. I actually learned a ton from this, and I feel so much more comfortable talking to younger patients and things like that. So this was actually a really good exercise for me. Thank you so much, Brittany. I thought you did such a great job.
Thank you.
And we're going to do a quick office tour of her office, Green Hills Pediatrics. I think it's beautiful, and if y'all live in the Nashville area, you should consider coming here.